Hello and welcome to NJBIZ Conversations. I'm your host, Jeff Kanij. My guest today is Paul Howe. He is the Chief Operating Officer at Protega Pharmaceuticals, which is a specialty pharmaceutical maker in Princeton. Paul, welcome.
Thank you. Great to be here, Jeffrey. Thanks for the opportunity to speak today with you. Really
Well,
appreciate it.
thanks for taking the time to do it. Now, as I understand the company, and which was why it was interesting to me, Protega develops an abuse-deterrent pain management technology. So let's start with that. The product I think is called Roxybond. Am I right about that?
That's correct.
Okay.
Yes.
So explain
Roxy.
what abuse-deterrent technology means in this
Right.
context.
Yeah. In this context, we have the only abuse deterrent technology FDA approved. We commercialized a few years ago, and it's a medication that if it's taken orally, so it's an oral medication, it works just like it should. Immediate release. In this case, for pain management,
Mhm.
our technology is called SentryBond, the technology inside the tablet. And in essence, if somebody manipulates that tablet, it then creates a viscous material so that you can't misuse it as far as
Okay.
inhaling, smoking, or injecting the medication, which obviously recreational and drug abusers, that's what they want to do. They don't want to just take it orally. They want to mix it with other medications potentially. They want to manipulate it so they can get the euphoria. And if you manipulate the tablet, it's essentially much lower and slower as far as the efficacy and the peak.
Lower and slower. So just so we're clear, the tablet itself cannot be changed in the way that abusers would want to
That's
and do something else with it. But yet it's still, as you say, it still works the same way it was supposed to. So how does that work? What is it a coating on it? I mean, I saw the diagrams on your website, but I still couldn't quite. It's hard to visualize unless you have somebody who knows what they're talking about explain it.
right. There's multiple inactive ingredients inside the tablet,
Okay.
over 20 inactive ingredients that then, when manipulated, those inactive ingredients mix with the oxycodone and then render it into a very, very tough, the way that the ingredients mix, this viscous material that makes it very, very hard to get, whether it's inhaled, smoked, injected. Even with an 18-inch gauge needle, you can't inject this once you put a
Right.
liquid in it because of what happens. So it sounds simple, but
Hmm.
it's very, very hard to create an abuse deterrent medication that's immediate release versus extended release.
Right.
So
Right.
extended release, you can create these layers, you can do different things with multiple different tablet coatings. With this, so that's why it was so unique. Pfizer tried to do the same, what's called a tech transfer with the
Yeah.
tablet with an amino, and didn't work. It's same thing with Mallinckrodt. And so we're very fortunate. Dr. Stefan Eigner is our founder, co-founder. He and the scientists were able to figure it out back at a company called Al Pharma before they became King, and then they became part of Pfizer. But the
Okay.
point is that so this has been a technology that's been worked on for years, and we're fortunate enough now to have it with one of the most widely abused medications in the United
Right.
States,
Right.
in this case, oxycodone. And we
Right.
are
So
looking at
so
other. Yes, go
I'm
ahead.
sorry. Go
Sorry.
ahead.
And
No,
we're
go ahead.
looking at other development programs as well. But this one right now, there's 40 million prescriptions a year still. It's been a very stable market. And actually, pain patients now have gone from 20% of Americans to 24.3% based off CDC in February. They came out with some new stats. Unfortunately, pain's going up. Chronic pain, obviously, with the aging population, chronic pain is defined as 3 months or more of pain a
Hmm.
year. That doesn't mean everybody, 1 in 4 patients or 1 in 4 Americans you need an opioid, but about 8% do. And
Okay.
and if they don't get, there's appropriate ways, obviously, if you're going in for surgery, those type of things, or if you have scoliosis or some other severe pain, this is sometimes the only option for patients to get out of the lazy boy. So they're going to walk around the block,
Right.
have activities, or even just like my mom who has scoliosis, a quality of life that she wouldn't have otherwise without some form of medication. So,
Okay.
yep.
Yeah. Well, you said a lot there, and I was going to get into the market a little bit later, but let's talk about it now. I mean, yes, I know from personal experience, a lot of folks are deal with chronic pain and do have to deal with this. So and just to be clear, you said it's oxycodone, so this is still an opioid. This is still
It
the
is.
very strong, effective pain reliever. Yes.
Right. Exactly. Yeah, it is still an opioid. It's an immediate release oxycodone. So there is still addiction risk, just like with any
Right.
opioid. You have to monitor. And then that we also, so behind the scenes now, we've met with the company and we bolted on a software platform for physicians that deal with a lot of patients that have chronic pain, where they get enrolled in a program for education that helps them how to taper down their medications, get off the medication, switch to non-opioids when possible. So just so you know, our vision as a company is to bolt on these platforms in addition to the technology we have, abuse-deterrent technology that creates safety, the safety nets, and
Okay.
guide and kind of the guideposts that help patients treat their pain, but also manage, other things they can do as well with our
Okay.
software
All right.
platform.
Now, yes, you mentioned the software platform. Is that the OPOS? OPOS?
That's
Okay. All right.
Opus.
Okay.
We have an exclusive distribution agreement that we signed at the end of last year. We officially launched in May, so it's very new. But for long-term opioid therapy patients that get enrolled in this, we're looking at creating a digital therapeutic, which is would be, if we did combined, it would be the medication with the software. Right now, they're two separate platforms, if you will.
Mhm.
So, but it's the same call points for us that we call them, the interventional pain doctors, chronic pain physicians. And so for us, we go in, we can introduce the only abuse deterrent immediate release medication to chronic pain doctors. And then we can also say, by the way, we've got this great software platform that can help you with risk mitigation, risk stratification for your patients, and then help your patients from an educational standpoint learn how to titrate and their medications down.
Right. And is the tablet itself more difficult to take, or is it just is it sort of the same sort of tablet that anybody would be used to if they had been taking something like this?
Yeah, it's the same tablet. The
Right.
the thing that doctors do like about it is that it's the only brand, it's the only branded oxycodone. So you get the same color, same shape, same size tablet every time you get your medication at the pharmacy. Versus with the generics in this space, the generic immediate release, there's no abuse deterrent. They're all different colors, shapes, sizes that you're
Okay.
getting, and there might be a little because it's generic. There's a little more variation potentially in the efficacy of the tablet, higher, lower. So you're getting a much more tight efficacy,
Okay.
range with a brand. So, but there's nothing else. It's just like any other medication when you take it orally.
Okay, right, but yeah, only because I mean, I was talking to another kind of pharmaceutical company, and I was made aware of the fact that some people do have a hard time taking medication. So I'm just curious as to whether this goes down easily without a spoonful of sugar, as it were.
It does. It does. Yeah. The one thing that if somebody has dysphagia and they need to crush tablets and put in their applesauce, and this
Yeah.
would not be the tablet
Okay.
that you would do that with, right?
Right.
This is
Right.
it's somebody that has good ability to swallow, but it's a small, very easy to take tablet.
Okay. Now you mentioned you had FDA approval, which, as I think I read, was in October of 2024. So it sounds like you're pretty far along on the commercialization to meet that market that you were talking about. Where's the company now in terms of that?
Great question. Yeah, so we're out of Princeton, New Jersey. I don't know if I mentioned that in the beginning. So, but we've had 3 doses for several years
Okay.
available, about 3 years. We launched about 2 years ago with a 5 milligram, a 15, and a 30. But we had a void as a company with that 10 milligram, and the
Hmm.
whole space. But a lot of interventional pain doctors, chronic pain doctors, they're actually titrating patients down from higher doses
Okay.
down to that 5 or 10.
Yeah.
And usually the
Okay.
10 is the one now. It's growing in the marketplace to about 30% of all prescriptions, 32% are actually the 10 milligram. So we didn't have that. So doctors were struggling because they put a patient on abuse deterrent of 5 or 15, but they couldn't use the 10. Well, now we have the 10. Like you mentioned, in October, we got the approval. Now we have the full continuum for physicians,
Okay.
a 5, 10, 15, 30. And as you would expect, most of the prescriptions are that 5 and 10, a few and 15s, but
Okay.
very few 30s today. Where if you would go back in time, 5 years ago, 10 years ago, really probably about 10 years ago, you would see 30s, and then with a lot even higher doses, especially in the extended release space that were being used. And that unfortunately, is a problem when somebody manipulates that tablet. So with ours, that 10 milligrams been since October has really changed our company. We've had some pretty serious inflection in a good way, where a lot of physicians now can adopt the medication and have a safer, alternative.
Okay. And how about investors? What's been the reception in the financial community?
It's been great, especially after the 10 milligram. We raised around 16.5 million over the like 6 months since we got the approval
Okay.
between October and end of March. We are working on another round right now. We actually we this quarter we're on track to hit break even, and in fourth quarter we'll go profitable. As a startup, that's
Oh,
pretty
okay.
significant. We've
Yeah.
exceeded forecasts for 6 quarters in a row. We're a privately held company currently. We are looking at, we could do IPO. We are looking at some other development programs. So as far as where we are today, we could go it alone without raising additional funds as an
Okay.
organization here at Protega. But we're also thinking, let's start a development program for hydrocodone. The DEA, we've actually trained 14 different offices, DEA offices, relative to this as an alternative. So when they go in and they remediate a physician or a pharmacy, they'll say, why aren't you using abuse deterrent medications, whether it's extended release? There's some good extended release abuse deterrent medications, but it's a much smaller market. Or in our space, would be Roxybon.
Okay.
And so we're in a very strong position right now. We just kind of crossed over into that. I watch every Monday. I'm waiting to see our hit that official number on weeklies for break even, but we are right at that moment in time when we'll celebrate a little bit because we'll be able to, go it alone here. And then if we raise more money, then we'll start some new development programs. And so,
Okay. Well, you anticipated a couple of questions, which was what the future looks like.
yeah,
You mentioned the possibility of an IPO, more investors, a possibility of a sale at some point. I mean, are all of those possibilities on the table at this
they
moment?
are, and we've got essentially one pharmaceutical product with 4 doses, and then we've also got a software company that we're have an exclusive arrangement
Okay.
with. So we definitely need to either bolt on additional products over time that would be in the same space, or a strategic buyer that would be a good fit for additional products. So we're open to all those. The goal is get it off the ground, and typically, once you get profitable, like we will be by the end of the year, then I think there'll probably be some strategic potential buyers that'll look at us at that time.
Okay. Well, it seems like you're at a really good point in the market in terms of, yes, pain management is a big market, and you've got a product that deals with one of the main concerns that folks have with the drug that most people say is most effective.
Yeah, and again, Jeffrey, we're not trying to grow the market. Just to be
Mhm.
crystal clear, we're trying to make it safer. So
Right.
if you look at our vision statement, you would see in there that it's all about safety, safe for communities, patients, physicians, that mitigate the risk in their practice. So that's kind of where we stand on it, and our focus with our teams. So
Okay. Finally, before I let you go, I have to ask, what's it like doing business in New Jersey? You're exactly the kind of company that the state's boosters want here. You're a pharmaceutical company. You're here, I'm assuming, because you're in Princeton. Major research universities provide a steady flow of highly educated researchers and engineers and things like that. Is that what you're finding? How is it doing business in New Jersey these days?
it's amazing, and it's the best place I believe in the world. If you're gonna build a pharmaceutical company, the talent's here. So there's more talent in New Jersey than anywhere else in the country, obviously, probably in the world when it comes to pharmaceuticals, whether it's research and development, if you're commercialization. I mean, the talent level's just extraordinary here. And I've been involved with companies in New Jersey since 2000.
Okay.
So I started with Reliant Pharmaceuticals, which was bought by GSK, and then I went to work
Mhm.
for GSK for a while. But I've been worked with pharmaceutical companies in New Jersey since for 25 years now, which is hard
25
to
years,
believe.
quarter
I
century.
know I don't look that old, but I guess apparently I am based off the data.
No, no, no. You're as young as you feel. So.
Yeah, exactly.
All right. Well, I know you got to catch a plane, so I'll let you go. Paul Howe, Chief Operating Officer at Protega Pharmaceuticals. Thanks for joining me. I appreciate it.
It's been an honor. Thank you, Jeffrey. Really appreciate it. Have a great day. Thank
And
you.
thank you for watching. Until next time, stay safe, everyone.